Hello, everyone. Welcome. Happy Tuesday. You are joining the latest webinar for Cosmetic Laser Dermatology. We are very excited to be here today with Dr. William Groff. Hi, Dr. Groff.
Hello.
And today he is going to be talking about our Take 10 proprietary treatment that can take up to 10 years off of your face. So I see a lot of you joining. I'll just give you a second to get acclimated. While you are at the bottom of your screen, we have a Q&A function and a chat function. Ideally, you can start adding any questions you would like. If you already know what they are, you can ask now, or while he's speaking, you can ask questions. And at the end, Dr. Groff will take as much time as he can to try and answer all of your questions. So while a few more of you join, if we could go to the next slide, I'll just start telling you a little bit about Dr. Groff. So Dr. Groff is a board certified dermatologist at Cosmetic Laser Dermatology. The practice was established in 2010. We're very proud to have over 50 lasers and devices in the practice, which is one of the reasons we're able to do this Take 10 treatment, which you'll learn more about. We have 6 board certified dermatologic surgeons. All of them have capability and expertise with lasers, but even though Dr. Groff today is the one speaking about Take 10. We also have a custom cutting edge treatment and research center. So we have a number of research clinical trials that are going on at any given time. You can always see them on our website. And we're very proud that we pretty much have more lasers and energy devices than any other practice in the world. So we're very proud to have that hailing here from San Diego. So Dr. Groff specifically, I'm sure a lot of you know him. If you don't know him, you may have seen him in San Diego Union Tribune and the La Jolla Light, because he is the winner every year for the best dermatologist in San Diego. So we are so proud to have him on our team. Personally, he has over 19 years of experience. He's given over 100 different lectures on lasers all around the globe in 7 different countries. He's published over 16 publications just about lasers in scientific publications. And he's also an injection trainer for Allergan, who are the makers of Botox, Juvederm, and Voluma. So just like our other doctors also do lasers, even though Dr. Groff's only speaking today about lasers, he of course also has expertise in injectables, body sculpting, veins, and all different types of cosmetic dermatology. So with that in mind, I will hand this over to Dr. Groff, and I'm very excited for him to tell you all about Take 10.
So, thank you, Risa. I appreciate that. So you're all wondering probably what does Take 10 mean, or how do we come up with that name? It's actually a procedure that I've been working on and developing and changing for really, I'd say, the last 15 years. Prior to when I joined Dr. Goldman and Butterwick, Dr. Fitzpatrick and I were together, and we started kind of combining lasers, trying to find what the best combination might be. And really, it depends on the individual patient, but really, if a patient wants to make a dramatic difference in their skin, the wrinkling, the texture, the really 2 best laser choices are what's called a CO2 laser and an erbium laser. Now, the reason we call it Take 10 is because after the treatment, you're going to see that your skin, your appearance is going to look at least 10 years younger. So that's our goal. Now, some patients look 15 years younger, so that's great. So in their case, we'll call it Take 15. But we also, oftentimes before we do the laser treatment, half of our practice really is probably injectables. So as Risa said, that's a big part of our practice as well as lasers. So a lot of times before we treat these patients with lasers, we like to incorporate Botox first to help smooth and set kind of the canvas for the lasers. So, but we'll get into that as we get into some photos and things. But first, I want to show you a video that we put together that actually shows a patient going through the Take 10 procedure using a combination of lasers. You can actually see the lasers interact with the skin. You're going to see the lasers tighten the skin in real time. So I think it's a great video. So we'll watch that first.
So we can't hear the audio, so maybe you could tell us what's happening.
Oh, well, we should be able to hear the audio. Is there a way to get the audio?
It's okay, just tell us what's going on.
Is there a way we can get the audio? Risa?
At this point, I think it'd be better just to explain it.
Okay. So I can hear the the audio on my part. I'm not sure why y'all can't hear it, but that's going to make this a little challenging. Let me see if I can figure out.
Oh, Katie says she can hear a tiny bit of audio.
So is Paul here? Because he should be able to fix that. No?
Can you go into Dr. Groff? He has a question. Yeah, he's coming.
Okay. So I think it's important if we can watch the video. So I can just set this up though. This patient is, this patient's obviously I'm consulting with, and in the video, you're gonna see me walk her through the various stages of laser treatment. So hold on for 1 minute. Paul's here. He's gonna see if he can get us audio. So the audience, I can hear the audio here, but the audience can't hear it.
Okay, so while we're having some IT support here, if anyone wants to submit any questions, there's the Q&A feature. This would be a great time. Anything that you have questions on regarding Take 10 or laser treatments or injectables, I think it'd be a great time to use that opportunity. And okay,
let's try. Okay,
fingers
hold
crossed.
on. Can't hear it?
It's really quiet.
Go ahead. No, do that. Bring it all the way up. No, right. Okay. And here.
Okay, I'm really sorry, everyone, for this delay. So Dr. Groff, will you just talk us through and show us what's happening?
Sure.
Let's see if we can hear it.
It's just very quiet, and the sequencing, it's a little, it's not running smoothly.
Well, they should be able to hear it, but otherwise you're going to have to walk through. We're going to have to bring the volume back down. Yeah,
Okay, let's go old school. I'll explain what's going on here.
Thank you.
So I'm doing the consultation. I'm going to fast forward to the important parts. So the first laser that I'm going to start with on this patient is called the V-beam. And the V-beam, what it does is it addresses broken capillaries. So let me get it to the right. Okay, here we go. It's called the V-beam perfecta. And oftentimes, if you look at your skin in the mirror, you're going to see that there's broken capillaries in the nose area and the mid-cheek, chin, around the eyes. So this laser is excellent with combining this with the other lasers. You can see a dramatic improvement in the broken capillaries, the redness to the face, rosacea. So you can see in the video, I always include the ears in the treatment because you don't want to have this beautiful looking skin here and then you have all this sun damage on your ears. So it makes sense to, and that's what I'm doing. Now the next laser I like to use is called a Q-switched Alexandrite laser. And that laser targets brown spots. It'll treat flat brown spots. It'll treat the raised brown spots that are called seborrheic keratoses. You can see her face is a little red here from the V-beam treatment, but that's about it so far. So in a second here, we're going to see the Alexandrite in action. And this is one of my favorite lasers. I've used it on myself from head to toe for brown spot. It's very safe, very effective. One treatment usually knocks out all the brown spots. So it's a great tool. Now, these are the main lasers we're going to get to. This first laser you're going to see in action is the CO2 laser. This is the one that does the majority of the work as far as textural improvement, skin tightening, wrinkle reduction. Usually when I'm treating a patient, I'll start around the mouth, and you'll be able to see the pulses, and you'll be able to see the skin tighten up as I'm treating once we get a little closer here. Now this video is sped up a little bit, so I don't actually fire the laser that quickly in real life. But speaking of time, it usually takes me about an hour to an hour and a half to do a full face. Now what I'm doing here is I'm wiping off the epidermis, or the top layer of skin, which allows me to get deeper so I can smooth out that skin, tighten that skin, and eliminate the lines and wrinkles. Now the patient doesn't feel any of that. This patient's is very comfortable. She's been given an IV, so we give some IV sedation. We like to use usually fentanyl and Versed. Those are medications that are commonly used when a patient, for example, is getting a colonoscopy. We call it twilight sedation. But she's awake and I can speak with her, and of course she's breathing on her own. It's very safe, but it makes the patient very comfortable. Now you can see the skin tightening up in this video. You see that? This last laser that I'm going to use is called the Cyton erbium. This laser I consider my sculpting tool. So I use it to literally sculpt away any remaining lines around the mouth after I've used the CO2 laser. So it's kind of like a paintbrush in a way, but I can target individual lines and just sculpt, sculpt, sculpt until they're gone, or until I can't go any further. So you can kind of see that that's the erbium. Again, the video is sped up quicker than it would normally be in real life. Now this is back to the CO2 laser. Now we're around the eyes. So you're going to see some great instant tissue tightening. Watch the upper eyelid kind of jump. You can see it kind of jump, tightening. So when I do a full face, and you'll see this in a lot of the before and after photos, you're going to see that the upper eyelid skin gets tighter. So it's almost like a blepharoplasty or surgical tightening, but it's using a laser. So there's no cutting, there's no incision, there's no stitches, there's no scar from being cut. So this is a beautiful way to tighten your upper and lower eyelids without surgery. Again, I'm using CO2 and erbium in that area. Now you can see the CO2. This is the CO2 out in the on the nose and cheek area. Again, this procedure start to finish with the CO2, and there you can see the tissue tightening again. So this is really, there is no better way to tighten facial skin with technology than the CO2 and erbium laser. Hands down, nothing outperforms it. And you'll see that when you look at the before and after pictures. I think a picture's worth 1,000 words or more, and you'll see that in a minute when we finish this video. Let's see. I think it's just about done. Let's see if there's anything else to look at here. I don't think so. Maybe. When we post this video, maybe we can get the audio. I know that video is available on, it's on my YouTube. So if you go to Dr. William Groff on YouTube, you can watch that entire video with audio. But we'll try to make sure it's available when we post it. You can also go to my Facebook and Twitter and see all the before and afters I'm going to show you will be on there. So now this is the patient that was in the video. So on the facing you, but on the left side of the screen, that's her pre-photo. And then we merged it with her after photo on the right. So you can see a dramatic improvement in all facets of her skin. Brown spots, sun damage, tightening of the upper and lower lid, tightening of around the mouth, wrinkle reduction around the mouth, sunspots, everything looks better. Now this is her before and 5 months after. Now this picture looks like she has a little bit of makeup on, but the makeup's not covering these deep lines and wrinkles she had before. So she looks amazing. I mean, it's a natural way, again, to take off 10 years or maybe more. And I think some patients definitely do look 10 years younger or 15. So this patient right here, she's in her 60s. This is her before and after I treated her with that exact procedure that we just watched, the Take 10, the combination of the lasers. You can see, again, if you look at her upper eyelids, her lower eyelids, the lines around her mouth, the brown spots, all dramatically better. And this is just a different angle. But you can see that crepiness under the eye, which Botox doesn't address. The only way to really address it is with the CO2 laser. And when I say CO2 laser, I'm not talking about a fractional CO2 laser, although we have those here, and I love those lasers, but those are best used for acne scarring, maybe some surgical scars, things like that. For resurfacing a patient that's in her 40s, 50s, 60s, 70s, even 80s, you have to use a stronger laser, which I call a totally ablative laser. And the best one is the Luminous Ultra Pulse Encore, which is the one I've used in every single one of these cases and in that video that you saw. So, I mean, I like pictures because patients ask, what can it do? What can it do for me? Well, I always try to show a lot of images because certainly you'll find someone that skin looks similar to yours and you can see what kind of results you can expect. Let's go to a different patient. So this is a little bit younger patient. She's actually in her 40s, but she never had a thing done. So this is a perfect example when I introduced her to Botox. I said, hey, look, why don't we inject some Botox here, forehead, around the eyes. And I also did this muscle here on her face. It's called the masseter muscle. If you're a patient who grinds or clenches your teeth, or you've noticed that this area of your face is very broad, well, a great solution to that is to inject Botox in this muscle, which will stop you from grinding and clenching, will probably stop the headaches you're experiencing, but it also narrows the base of the face, which is very youthful. So we did that, and then a couple weeks later, I did the laser resurfacing procedure on her, the Take 10 procedure. And you can see this is her 2 months out. I don't think she has any makeup on, maybe a little bit of eye makeup, but that's it. So she definitely got, I think, 10 years back, maybe more. She's one of my favorite, I think, before and after. She just looks amazing. But you can see it removed all the sun damage, tightened her skin. Upper eyelids are tighter, her eyes look more open in all angles. So again, if you look at that under eye area, that's an area where Botox can't touch, but the lasers can do a great job with that. This is jump around different age groups. So this patient's in her 70s. I actually treated her and her daughter in the same day. And this is her about a little over 3 weeks, 4 weeks out. And I love this picture because it shows she's still a little bit pink around the mouth. So it takes generally about 9 to 10 days to heal from the procedure. But after that initial healing where the skin looks really nice, there can be some residual pinkness, and there probably will be. Now, will it last 2 weeks? Maybe. Will it last 4 weeks? That's possible, and it can last even longer depending on how much sun damage you have, how well you take care of your skin, and your skin type. So she's a little bit more olive skin, and I mean, you can see the dramatic difference in the wrinkles around her mouth. She still has a little bit of pinkness. Now, that pinkness will go away for her. I think it took another like 2 to 3 weeks, and then it was gone. So it's certainly worth. She has no makeup on. She put a little bit of makeup on to cover up that pinkness, and she'd be good to go. These are just different angles, same patients. You can see how it opened up her eyes, smoother skin. I mean, all the things that we really want for our skin to look younger, healthier, and take 10, 15 years back. There's a close-up of her eyes. I really love how it can tighten that upper eyelid skin, because really, when you look at a face, where you start to age first and the most severe is around the eyes and around the mouth. And you'll see that it's a repeated pattern in every patient. There's a close-up of her mouth. Different angles showing. Again, you can see it's a little more pink here. I had to do a little bit more work. I had to go a little bit deeper there, but certainly well worth it. I mean, you can see how it tightened up even the jowling there. Here's another patient about a month out. I really like her result overall, but I really, again, you can see the aging around the eyes and the aging around the mouth. And if we can reduce those lines and wrinkles, tighten up that eyelid skin a bit, makes a huge difference. There's a close-up of her eyelids, and I can see how it tightened and smoothed that upper eyelid skin all the way out here even. And of course underneath as well, it looks tighter, smoother, which actually will reflect light better, which is more youthful. When skin has all kinds of nooks and crannies and crepiness, it absorbs the light and looks dull. When you make it smoother and tighter, it reflects light better, and that's why younger skin has better light reflectance. There's a close-up of her mouth. You can see those deep lines. They refer to them as smoker's lines, but many of these patients never smoked a day in their life, but it's just from pursing the lips over time and so forth that these lines develop. So there's the same patient, different angle. Here's a different patient, a little further out this time. So she's 6 months out. I don't think she has an ounce of makeup on there. You can see again how her skin's is tighter, smoother, more youthful. Looks like her, looks like a younger version of her. Not overdone, doesn't look weird and pooled like you can get with a surgical facelift. We've all seen patients who've had eyelid surgery and it looks unnatural. So this patient, again, if I recall, she's probably, I think she's about 71. And you can see a tremendous amount of spotty sun damage. The other thing about aging skin is it gets a lot of spots, discoloration, unevenness to the skin. If we can even out the color of the skin like we did in her case, it looks much better, but also dramatic reduction in lines around the mouth. Now, interestingly, if you look down at her neck, I did a procedure on her neck called ThermiTite, which tightens the skin. That's non-surgical. And I also did a laser on it called the fractional repair, which is a way of safely resurfacing the neck skin because the neck skin is more susceptible. You have to treat it more gently. Here's a 51-year-old patient that again, same take 10 procedure, laser resurfacing using that unique combination of lasers, the way we do. And again, she looks amazing, I think. She looks nice, smooth, clean, no makeup, awesome. Different angle, same patient. Again, if you look at her pre-picture, lots of brown spots. That always ages the appearance of the skin. Just getting rid of the lines and wrinkles in this area and out through her cheek made a huge difference. Different angle, no makeup. Now this patient, she's 3 years out here. Hispanic patient. You can see again, same qualities we see in the other images. Tightening of the upper eyelid skin, tightening of the lower lid skin, dramatic wrinkle reduction with the parentheses lines here. So she looks great. I like to show a lot of pictures that shows the reproducibility of the procedure. I mean, if you go somewhere and they're like, oh yeah, I got this great procedure you can do, it's called 6D, or they make up some fancy name, say to them, hey, can you show me like 20 pictures of this procedure that you've personally done on that patient? And if they can't show you pictures, it tells you they haven't done the procedure long enough or the procedure doesn't work. So, well, that's my bit of advice. If I was looking for someone to do a procedure on me, that's what I would ask. So again, you can see the reproducibility of this procedure. You can see the dramatic wrinkle reduction, the tightening and smoothing of the skin through the cheeks. This patient actually flew down from Northern California. She wanted to look better for her son's wedding. So what did we do? We did take 10, tighten and smooth things up. She's very, very happy. Looks great. There's a close-up of the mouth. Again, you can see all the tightening through here and the smoothing of the skin. So I actually run the laser. If you look at her lip in the upper picture and the lower picture, you can see how it looks less sun damage. I always run the laser over the red portion of the lip as well, unless the patient doesn't want me to do that, because the lips get sun damage just like the rest of the face. This is another one of my favorites. I just think she looks awesome. Getting rid of the lines here, tightening that upper eyelid skin, tightening that lower lid skin, made a big difference for her. You see the eyelid skin all the way through. So when I do the CO2 laser and erbium on the upper lid, I take it right up to the lashes, and the same on the lower lid. Here's before and 1 month after. Again, a little bit pink, but looks awesome. You can see this kind of wrinkling through the cheek is very hard to get rid of, and with this approach, we can make quite an impact. This girl, she's a younger girl actually, but had really pretty deep lines here. So we cleaned up a lot of the brown sun damage, or I should say I cleaned up a lot of the sun damage. And we got rid of the lines here. So anyway, every single patient I showed you, they're all my patients, by the way. I don't show other people's patients. I don't show company photos that the laser company did. They're all my patients. So now I want to talk to you a little bit about ThermiType, because this is another one of my favorite procedures that I oftentimes will combine with laser resurfacing, because you address the face. A lot of patients, of course, want to naturally address the neck. So what happens to the neck over time? It starts to lose elasticity and fall, and you get some fullness under the chin, and you start to lose the definition in your jawline. So these are things all that ThermiType can address. And this procedure, as a stand-alone procedure, you could literally drive yourself here and drive yourself home. Because what I do is I inject numbing solution through the entire portion of the upper neck, and I'm able to do the procedure. The procedure involves using a needle that's the same size as, say, when you donate or give blood for lab work. I take that needle, I make a tiny little poke under here, one on either side. Now through that little poke hole, and I have a great video of this on YouTube as well, through that little poke hole, I can insert, it looks like a thin metal straw, and I can take out any little bit of fat that might be in the upper neck. Take that little metal straw out. The next thing I do is insert, it's a thin probe that's about the size of a piece of spaghetti. That's hooked up to a machine via wire, and that probe generates radio frequency energy to the undersurface of the skin. So directly to where we need it. It's underneath and directing the radio frequency outwards to the skin. And that's what causes the tissue tightening. So let me show you some examples of this. Now this patient, I did a light take 10 on her face, because she didn't have, her sun damage wasn't that bad. But I did the ThermiType on her neck. You can see a dramatic difference in the tightening of this portion of her neck. You can see how the deep horizontal lines are softened on her neck. That's a good angle. And you can see how it helped reestablish her jawline. These are just different angles. Again, if you look at the pre-photo, she virtually had no jawline at all. Her face kind of melded into the neck, but now you can see in the post that she has this nice crisp jawline. This is much tighter through here. This is another patient I did ThermiType on with the micro lipo, and you can see 4 months out, she looks awesome. Such a big difference. Some different angles. Again, she didn't have much of a jawline. Now she actually has a jawline, and this area is much better. We call it the submental area, so below the chin. Here's a patient, late 50s. Again, started to have some, hers was mostly just loss of elasticity, not really much fat there at all. But you can see 1 month out, she looks dramatically better. This patient, another patient, same procedure I did on her, 6 weeks out. The beauty of the ThermiType procedure is that you see almost instant gratification within a week oftentimes. Sometimes even days. And then it continues to improve for 6 months or longer. So I'll see a patient at 2 months, they look awesome. I'll see them at 3 or 4 months, even better. So this is another combination patient that I did take 10 on the face with that ThermiType procedure in the neck. So not only do you see the tissue tightening of the upper eyelid, the dramatic textural improvement of the face, but look at the angle of her jawline and her chin, and the texture of the skin on the neck as well. So she really got, I mean, I love her results. She's only a month out, still a little pink under the eyes, but she doesn't have a stitch of makeup on here. We try not to have patients ever have any makeup on, but it's really hard to sometimes get patients coming without makeup on. She has nothing on right now as far as makeup. Again, look at the angle of the jaw, the quality of the skin on the neck, and certainly the quality of the skin on the face. All the broken capillaries in her nose are gone, brown spots gone. Yeah, she looks great. It's another angle. So these procedures, although it seems like it aren't just for women. We have guys come in for this too. Now, is it true that 90% of our patients are female? That's probably true, but men are starting to get more into cosmetic procedures, as they should, because, who doesn't want to look their best? So this is a gentleman that I did the ThermiTite with microlipo, and you can see 6 weeks out, he looks much better. You can see there's no scars because there's no cutting. Everything heals without a trace, basically. Now, this is a good photo because this shows a patient literally 3 days after I did the ThermiTite on her. And if you look very carefully in the after photo, you can see my entry point. This looks like a little dot. So, of course, that ends up healing. It's only 3 days, but it ends up healing with no scar, marks, whatever. Here's the frontal view. This is why I say this is a procedure that for many patients they can do and take very little time off work, because you can see she already looks better 3 days out. She just has a little trace of bruising under her neck, but barely perceptible. A lot of patients get no bruising at all with it, which is amazing. Here's a upper 40s year old patient again, just to help reestablish a better angle. Here's that patient we showed earlier, Take 10 ThermiTite Fraxel combo. Here's another one, different angle, same patient, ThermiTite, 5 months out. So for a non-surgical procedure, it's really awesome, and that's why I love it. I like things that are impactful. I oftentimes will turn patients away. I'm not afraid to say, this doesn't work, that doesn't work. I always be honest with my patients. I want happy patients. I want patients to come back that look awesome and they're happy with their treatment. So I'll only recommend things that actually are significantly impactful or worth your time. And just another patient that I did ThermiTite on. Same patient, different angle, looks great. So I actually have a fair number of patients in their 30s that come in for this, and even 20s, because a lot of times there's this little bit of fullness there that's genetic. I mean, the patient can be in great shape, works out, and there's this stubborn little thing there. And this is a great procedure for a patient like that. Here's a 60-some-year-old patient. So I did Take 10 on the face, ThermiTite on the neck. You can see how tightened up this skin for her, and her face, of course, looks amazing. All these broken capillaries are gone. The lip lines are gone. You can see again the tightening and the wrinkle reduction. One last laser I want to mention that oftentimes we'll do with the Take 10 procedure is, and a lot of patients aren't even aware that these are treatable. A lot of patients have these dark blue veins either in the eye, underneath the eyes, or in the temple area. So we have 2 lasers that actually work for this. We have one called the Cool Touch Varia, and we have our newest laser. It's called the V-Beam Prima, and they both address these blue veins. So this is a patient I treated before and after. And here's a different angle, straight on of a different patient. You can see the blue veins up and until the temple area here. Oh, sorry. And then another patient, if you look at the blue bulging vein, and you can see it certainly in her temple area, this is a great treatment for that. This is usually a once and done treatment. Usually patients get 80 to 100% clearance with one treatment with the Cool Touch Varia or the V-Beam Prima for the blue veins. We call them reticular veins. So I think we covered it, Risa. I think at this point we'll take some questions from our audience, right, Risa?
Yes, thank you so much, Dr. Groff. That was great. Your kids are so adorable to look at here, and it's so amazing to see all these photos. We have a lot of questions that have come in. So get us started. If anyone else has a question for Dr. Groff, this is the time. Please go to the Q&A and pop it in. So here we go. A lot of you actually asked similar questions to this. So Dr. Groff, is Take 10 primarily for the face, or can we use it on the arms or elsewhere on the body?
Take 10 is specifically geared towards the face or the neck area. You know, the face you can treat with fairly intense lasers. As you go down the body from the neck onto the chest and arms, you really have to lower the strength of the laser. So while those areas are all treatable, you may not get the same dramatic effect. But the lasers we use for Take 10 in general, the CO2 and erbium lasers, we do not use on the body in general.
Got it. Okay. So here Teresa says, can it tighten the skin under the chin and on the neck?
Well, yeah, I think I showed a bunch of pictures of that procedure I do specifically for that, which would be the ThermiTite with microlipo combined for many patients. Again, I have a great video on my YouTube channel, and I'm sure on the Praxis YouTube channel too. So if you go to YouTube and type in just Dr. William Groff, you can find that video. But that's the best way non-surgically to tighten the neck is going to be ThermiTite. You know, over the years, I've used, hundreds of different devices, and that's really the one that's been a difference maker for tightening of the neck skin.
And I also popped in the chat the video that you were referencing earlier. So if anyone is capable of going to the chat, you can grab it from there. Or if it's easier, you can pop your email or phone number into the chat and we can send it to you directly.
I like this question. Someone said, sorry, Reese, I didn't mean to cut you off.
Oh, no, if you're seeing the questions too, go ahead.
Yeah, I can see them. Someone said, can you just have the broken capillaries treated? And absolutely. I mean, every day I use usually the best laser for that's either going to be the V-Beam Prima, or sometimes we use IPL or photofacial. So it just depends. That's where the physical exam comes into play, so we can make the best decision. But absolutely, if you have brown spots and you only want to treat brown spots, we can definitely do that.
Okay, so here's one from Stacy. Do you use the same protocol for the neck?
The protocol for the neck, again, face skin, neck skin, two different animals. The face, I can be as aggressive, probably the most aggressive is anywhere on the face, on the body, I should say. So, in other words, the face I can treat intensely. The neck, you have to drop the intensity down. Now, that doesn't mean we can't have a huge impact. It's just that it needs to be approached in a different manner. That's why if it's a tightening issue, I will do that ThermiTite procedure. If there's a tightening issue and a textural or wrinkled issue, then in the same day, I'll use the ThermiTite and I'll do Fraxel Repair, which is a resurfacing laser that's safe to use on the neck. So that's why it's important. I love the fact that we have over 50 lasers because I can pick and choose whatever tool I want. I'm not limited at all. So I can pick what's best for the patient to get the best job done.
Okay, so here's one from Teresa. How long does it last? Is it permanent or will I need to get the procedure again?
I wish it was permanent. I wish Botox was permanent, but nothing in our field or in plastic surgery is permanent. But now that being said, I'll generally have on the short end, patients might come back in 5 years. On the long end, patients may come back in 10 years, but it's long lasting. So somewhere in the 5 to 10 range, with probably 6 or 7 years being the average until a patient. I've seen a lot of patients where I eliminate their lip lines and even 10 years out, they're still going. So.
Beautiful. Okay. So a couple people are asking about the cost.
Okay. Well,
oh, you go ahead.
Yeah. Well, you can answer that if you want.
Okay, I was going to say that the cost is not something, there's not a straight number that Dr. Groff can give you. The Take 10 is basically a combination of multiple lasers depending on your unique needs. So Dr. Groff, depending on which lasers he determines is best for you, that's what's going to come up with the price. So it's very hard for us to give a blanket statement here. But we do offer free consultations, so maybe that's a good compromise, that if you come in, we can definitely give you a price. You don't have to pay for that, as well as talk to Dr. Groff in person or virtually.
Yeah, we can do virtual consult too.
The last time we did this Take 10 webinar, we weren't open yet post-COVID, so this is very exciting that now you can get in and see Dr. Groff virtually or in person. So here's another question. Fabulous results. Thank you.
Oh, thanks.
Thank you. Do you combine CO2 laser with thermage for the eyelids?
Well, we have thermage, and actually I think we have a couple of thermage units, but there's really no point to that because you get such amazing tightening, predictable tightening with the CO2 and or erbium there would be no reason to. It would just add cost to the procedure without any additional benefit and maybe increase, risk. So no, I've never done that.
Okay. So Jenny says, how does Thermitite different from Ultherapy or Soft Wave, and does it have similar results?
We have all therapy here, and all therapy is ultrasound, and it's delivered from the surface of the skin. So where Thermitite, you actually deliver the energy from the undersurface of the skin. So Thermitite's more efficient delivery of energy. And I love Ulthera and I do it on the right patient, but honestly, the results, if you have laxity here, if you have fullness here, if you want to redefine your jawline, all you have to do is look at before and after pictures. Thermitite by far blows any technology out of the water. I mean, the pictures, I'm not just saying my pictures, but in general, but the Thermitite pictures, the results, I mean, you won't find anything like it online.
Yeah. Okay. So someone else said, I missed the first 15 minutes. How can I
Oh,
rewatch
no.
later? I am happy to tell everyone that this is being recorded, so you can watch it absolutely right after this is done. We're also streaming live on Facebook, so you can go get back and watch. And it will be available on YouTube and our website tomorrow, and we'll send it out via email this weekend. Okay, here's another great question. How many combined procedures can be used in a single visit?
Well, I assume by procedures, you might mean lasers, but for example, if a patient came in and needed volume, we could do, say, I could add volume to the temples, the cheeks, and then I could do all the laser resurfacing using however many lasers I need in that one day to accomplish our goals. So it's safe to combine 5, 6, 7 lasers if needed in one treatment session. I've done that plenty of times, as you can see in the Take 10. But you can do fillers at the same time as well. And in the same session, we can address the neck. A lot of patients, I'll do work on the chest for sun damage at the same time. So a frequent combination of treatments would be Take 10 or laser resurfacing on the face, Thermitite on the neck, and then maybe doing B-beam and alexandrite for redness and discoloration, and possibly Fraxel for texture. So we can combine a lot of things in one day safely.
Beautiful. Okay, so how many years does the Thermitite results last?
Well, let's see. We've been doing, I think the device probably came out now at least 6 years ago. And in that 6 years, I haven't had to redo a patient yet. So I would say at least a few years.
Okay.
It's got good longevity for a non-surgical procedure, for sure.
Yeah, and I think it's important to add, like you said before, that even surgery, it does not last forever. We continue to age.
Totally.
Okay, so a lot of people are asking about the downtime. So can you talk a little bit about what's the downtime of the procedure and what kind of aftercare is needed?
I would say, well, okay, so let's talk about the Take 10 laser resurfacing facial portion of the discussion today. The average patient will be healed. In other words, so after the procedure, there's redness, there's swelling, and we have you keep a nice thin layer of ointment on your skin, okay? Now, the healing and peeling process takes 9 to 10 days. And then at that point, your skin will look great, it'll look smooth. There's gonna be some degree of pinkness to the skin, but that's usually when you can start wearing sunblock and makeup again, 9, 10 days. Now, are there some patients that are 11 days? Sure. Or, maybe there's some patients that are 8 days, but it's somewhere in that range. The only thing you need to do after is keep a thin layer of ointment on your skin, and we have you do soaks a few times a day on your skin, which is pretty easy. And patients like the soaks, they feel good. It's extremely rare that I have any patient that's in pain after a procedure. So we don't have to give you pain medications, because 9 times out of 10, when I see a patient the next day or 2 days later after doing the laser work, they have no pain. So as bad as it may look initially with the swelling and all, it's not a painful recovery, which is reassuring to a lot of patients.
Okay, before I get to the next question, two really nice comments. Someone says, super impressive results. I now think I will never get old looking.
That's good news.
And then,
That's
oh, sorry. And then Julie says, Dr. Groff did my mouth with laser, and I previously had eyes done about 10 years ago. Fantastic. So
Yay.
that's
Thanks,
a good,
Julie.
that shows a lot of longevity. That's a full decade for a take.
That's pretty good. Yeah, it's not uncommon to get that 10 years. It looks like someone said which laser helps with the lip line. So that would be I use the Luminous Ultra Pulse Encore CO2 laser in a totally ablative mode, and then the Cytona Erbium in a totally ablative mode. You may have missed the video, but you can watch and see those in action.
Okay, so how long does it usually take for the patient to come out of the treatment with the IV sedation? When do they go home?
Okay, good question. So the procedure generally takes, once I start lasering, I would say it takes anywhere on the short end to 45. The short end would be 45 minutes. The long end, probably an hour and a half. Now there's prep time before that. We have you sit with numbing cream. We give you an IV. And then afterwards, you're probably here for an additional half an hour. So you'd be here easily 2 hours, 2.5 hours that day.
Okay.
Yeah.
So this is a good question. Can you just do your lower face and neck if they've previously had a bleph and brow lift?
Lower facing. We can definitely do the neck alone. That's a no-brainer. About doing half of the face, I mean, it depends how much sun damage you have. If you have a lot of brown spots and things, and we just did the lower half of the face, it may look odd. But what I do a lot of times is, because if you look at the pattern of aging in the female face, the wrinkling is much more intense on the upper lip in this area. So a lot of times I'll do this area. So from the nasolabial fold down to the jawline, including the chin and upper lip. So between here like this. Instead of doing the lower face, because this skin's oftentimes not as wrinkled as here. So it just depends on the patient, but that's where a consultation, whether it's in person or via computer, comes in to play, and I can look at you and assess what would be best.
Okay. So Jenny has a good question. Are you using twilight sedation, or if you're using twilight sedation, do you still use numbing cream? I ask because some people have said there's too much lidocaine to do all these areas. I'd like to do the Take 10 plus laser treatments on my neck, chest, and arms since I'm coming in from out of town to see you.
Well, that's where it's important to come, I think, to an office like ours where we have a lot of experience. We're actual board certified dermatologists who this is our passion. This is what we've been doing for me for 20 years. So we know how much, we calculate out how much lidocaine we use. Lidocaine is a drug just like any other drug, and you're absolutely right. You don't want to get too much of it. So we figure all that out for you so it's safe and you don't have any issues with too much lidocaine.
Is this suitable for all ages? What's the minimum age limit?
I mean, you know, I'll use CO2 and erbium lasers on people in their 20s that have acne scarring or have had some kind of trauma. So there's really no lower limit. I mean, certainly, obviously, a teenager is usually not going to need something like this, but certainly 30s, 40s, 50s. I think my oldest patient that I've ever done it on was in their mid to upper 80s. So.
Okay. So it seems like a few people on the webinar are out of town. Someone says hi from Mexico, and someone else is asking, how would you treat someone coming in from out of town? So maybe you could talk through what that process might look like.
Well, the nice part about being in San Diego, such a beautiful town, is it's a great place to visit, but our office is located just about, I'd say 15 minutes from the airport. So you can Uber here. We have, there's multiple beautiful hotels in the area, and walking distance really. So oftentimes one of our nurses, Phyllis or Carrie, my head nurse, will work with you and help you figure out where to stay and whatnot. It's really simple because it's San Diego is a big city and we got so many options, and our office is in, like I said, a great, really an ideal location. So we help you out with all that stuff if need be, but it's really easy to find somewhere close to our office to stay.
But we can do a virtual consultation ahead of time and get them all ready so they come
Oh
into
yeah.
town.
So a lot of times out of town patients, what they'll do is, I mean, virtual consults are great because we get to talk and meet each other that way. But the best is to do that maybe in conjunction with you emailing us photos, because when you email a digital image, the quality is so much better than on these video conferencing things. So that's the best way to email photos, a straight on, one from each side like this, and then we can do a virtual consultation.
And then when they come in town, when they come into town, how long might they stay in San Diego for?
Oh, well, ideally, I'd like them to stay at least close to a week anyway. Now, believe it or not, I've had patients fly out the next day. Not really my favorite option. I'd like them at least a few days. A week's probably ideal.
Okay. And luckily, San Diego is not a bad place to be for a week, like you said.
That's right.
Okay. Can you safely use the CO2 laser on a medium complexion?
Yeah, so there's different settings for different skin types, and so that's where experience comes into play. But yes, medium, what I refer to as a medium skin type, yes.
Okay. Let's see. So a lot of people are still asking about the neck and the chest. And so do you want to answer one more time about the chest and the neck?
Yeah, they're all treatable. I mean, of course, our website is a great source of photos, before and afters, explanations for the lasers. So, but no, I mean, gosh, I treat chests and necks every day because they age just like the face. So, I mean, the face just probably is the most common because everyone wants their face to look the best. And then next, probably second priority, chest, third priority, and it goes down from there. But
Okay.
patients head to toe for sun damage and what.
What is the laser is best for those large blue vessels under the eyes?
We have two lasers that I like for that. I use the Cool Touch Vari and the V-Beam Prima. I can really use either. Again, I have a ton of before and after. Some my Instagram, Facebook, on our website. You can go anywhere. I got a ton of them because I love the treatment. It's predictable. It works. It's quick. It's instant gratification. I've had patients, I mean, literally cry after the procedure because when I'm done, I'll hand them a mirror and their veins, they can't see them anymore. It's awesome. It's one of my favorites as well.
So great. Okay, just some comments. Thank you so much, Dr. Groff, for writing all this great information. I loved seeing the various photos from different stages, from days to years. It's truly amazing work.
Oh, thank you.
Thank you. Let's see. Can you maybe talk one more time about the order of lasers that you like to do them in for a take 10?
Well, order generally we go from the less intense and say the most intense for the last. So I usually start with the V-beam for the broken capillaries. If a patient has broken capillaries, let's just assume. If they have a lot of brown spots, then we'll go to the next laser, which is the Q-switched Alexandrite. And usually from there, we'll go to our main room, which has the CO2 and erbium, and then we'll finish with those two.
Okay.
So, now, if we're doing the neck at the same time, you know, it doesn't really matter, but I usually will do the neck work, like the thermitite first, and then follow it with the other lasers. So
again, these questions, some of them are a little hard to ask because this is so customized per patient. It's really going to be unique to your needs. I think that's what.
sure.
Okay, only a few more questions. We're almost done. What is the difference between a V-beam and XLV?
I'm sorry, can you repeat that one?
The XLV laser, how is that
Okay.
different from V-beam?
Well, the XLV is a different wavelength. I mean, I've used it in the past. I like it. You can get great results with it. I don't have anything bad to say about it. It's a little more sensitive to skin type, meaning that you have to be more careful with patients who have pigment, a little more pigment in their skin, but it's effective for broken capillaries too. I like it. I mean, that's one we don't have here though, but I've used it in the past.
Okay. And then a couple people are asking about what products you recommend for people to use pre and post treatment.
Pre doesn't, unless you have a little bit darker skin, if you're fair skinned, probably nothing. But if you have more melanin in your skin, say whether Hispanic, Asian, the little bit darker skin type, I'd probably pre-treat with some kind of like hydroquinone or Lytera, something that would minimize the chance of getting temporary darkness after the procedure. So that's it though. And then after the procedure, initially we just use Aquaphor through that 10-day or so healing period. Then after that, I'm a big fan of Skin Medica. I don't work for them or do any work for them, but their products are based on science, and that's what I use for myself. So I probably usually talk to my patients about Skin Medica products, growth factors, things like that.
Okay. 2 more questions. I've been told that neck thermage scarring can cause some difficulty later if I want a lower facelift. Would Thermitite have the same effect? So I guess if you have Thermitite, is there a concern they couldn't have a lower facelift in the future?
No, you can definitely, it doesn't affect the ability to have surgery at all. That's safe for that. I mean, it's not an issue.
Okay.
As plastic surgeons, because I used to work with 5 of them, like even from fillers, you know, they can tell when they do a surgical lift, but it doesn't impact their ability to, either does the lasers.
Is it good to refrain from Retin-A before the lasers?
I have patients continue the Retin-A right up to the day of the procedure. I've never had a problem.
And if someone's had open heart surgery, are they still a candidate?
Yeah, now depending on your individual situation, I would sometimes will ask, you know, I'm happy to speak to your cardiologist, or we'll just sometimes ask for a note saying it's okay to do it. But, you know, it's always better there on the side of caution. So, but no, I've done plenty of patients who've had open heart surgery, all kinds of surgeries, all kinds of medical issues. We don't, we're very thorough with our pre-operative questions and interviews. So if there's anything that we're even the slightest bit concerned about, I will consult with your physician to make sure we're good to go.
Okay, and last question. You talked a lot about neck tightening with Thermitite, but you talked about upper eyelid tightening with the Cyton, erbium, and CO2. Can those same lasers also do tightening on the neck?
Those would not be the lasers I would use for tightening on the neck. It's much safer and much more effective tool. Different part of the bodies respond differently to different technologies. So I would always use the Thermitite, possibly in combination with the Fraxel Repair, which is a fractional CO2 laser, a little bit different, but safe to use on the neck.
Okay, great. All right. Well, thank you so much, Dr. Groff, for answering all of these questions and staying on. A couple of people are, if you guys have any more questions, I see a few more coming in now. Please feel free to ask them. You can send us an email or set up a virtual or in-person consultation with Dr. Groff. He is open and has availability. Otherwise, we really appreciate you coming. This Take 10 procedure is really popular. It's one of the most requested procedures we have, and it's not surprising because of the amazing results that Dr. Groff is able to give. So we appreciate your feedback. There's a survey that's going to come up after this. Otherwise, thank you so much, Dr. Groff.
Thank you. Thanks everyone for listening to the webinar, watching the webinar, and I'd be happy to meet with any of you if you so desire. Thanks for your time.
Thank you. And you can watch this recording again, like I said, on Facebook or on our website, and it will come out this weekend via email. So everyone have a great Tuesday night. Thank you so much.
All right. Good night.